Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about coenzyme Q10 from cellular energy to anti-aging potential. CoQ10's fundamental cellular roles: energy production, crucial for efficiently transferring electrons within the mitochondrial oxidative respiratory chain, leading to the production of adenosine triphosphate, ATP, the body's primary energy currency. It's a potent antioxidant. It effectively mitigates vascular oxidative stress, particularly in individuals with hypertension, by potentially increasing vital antioxidants like superoxide dismutase. It lowers lipid peroxidation levels by diminishing pro-oxidative compounds. It improves blood flow and safeguards blood vessels by preserving nitric oxide. Factors affecting Q10 levels and deficiency. Endogenous synthesis inhibition. Statin drugs inhibit the mevalonate pathway, a biochemical route leading to CoQ10 synthesis. Researchers theorize that statins may contribute to CoQ10 depletion. Muscle pain and cramping, myalgias, are frequent adverse effects of statins, often attributed to diminished CoQ10 levels. Primary CoQ10 deficiency, a rare autosomal recessive disorder caused by gene defects in CoQ biosynthesis. Clinical features can include steroid-resistant nephrotic syndrome, optic atrophy, retinopathy, and encephalopathy. CoQ10 replacement therapy is indicated for this rare disease. Clinical applications: cardiovascular health, heart failure. In studies, supplementation effectively reduced vascular mortality, all-cause mortality, and hospital stays for heart failure at 2 years. It requires long-term use. It's associated with symptom reduction and reduction of major adverse cardiovascular events when used in addition to standard therapy for moderate to severe heart failure. It may improve functional capacity, endothelial function, and left ventricular contractility in congestive heart failure. Endothelial function. It may improve endothelial function in patients with ischemic left ventricular systolic dysfunction, heart failure, type 2 diabetes, and hyperlipidemia. Hypertension and cardiovascular mortality. Data is conflicting on treating high blood pressure. However, combined with selenium, CoQ10 may decrease cardiovascular mortality risk in healthy older patients and those with existing cardiovascular conditions. Neurological and musculoskeletal health. Fibromyalgia shows potential to decrease pain, fatigue, and morning stiffness. Migraine prophylaxis, beneficial for prophylactic treatment of migraine headaches in children and adults, potentially decreasing frequency, severity, and duration. Low CoQ10 levels are common in pediatric headaches. Mitochondrial disorders. Moderate to high dose CoQ10 may influence vital exercise aerobic capacity. Neurological and musculoskeletal health. Statin-associated muscle symptoms. Supplementation 100 to 600 milligrams a day in random controlled trials has decreased SAMs, improving daily activities. Other potential uses: emerging data, long COVID syndrome, promising but needs more research. Depression in bipolar disorder lessens symptoms as an adjunct or add-on. Improved subjective fatigue and physical performance in healthy individuals during exercise. Peyronie disease may decrease penile plaque size, reduce penile curvature, and improve erectile function. For example, 300 milligrams daily for 24 weeks. Polycystic ovary syndrome may improve fasting blood glucose, insulin levels, and total testosterone levels. Primary CoQ10 deficiency, early high-dose supplementation, 5 to 50 milligrams per kilogram per day, can limit disease progression. Assisted reproductive technologies, a meta-analysis suggests CoQ10 may benefit clinical pregnancy rates. Administration and safety, dosage forms and strengths. Oral supplements, tablets, capsules, soft gels, liquid, range from 30 to 600 milligrams per unit, widely accessible. Topical preparations exist but lack extensive research. Source: meat has the highest amount. Lab production via fermentation yields consistent and cheaper supplements. Adverse effects: it's generally well tolerated. Minor and infrequent, including stomach upset, nausea, vomiting, and diarrhea. Mild insomnia with dosages greater than 100 milligrams a day. Liver enzymes elevated with 300 milligrams a day or more. No reported liver toxicity. Tolerated up to 1200 milligrams a day. Key considerations and future outlook: monitoring and toxicity. Plasma concentrations average 0.34 to 1.65 micrograms per ml. No toxic blood level determined. Safe up to 1200 milligrams daily orally. Drug-drug interactions. Potential interaction with warfarin with a risk of treatment failure, and it's reversible. Insufficient data on interaction with chemotherapeutic drugs, therefore avoid. Contraindications, cautions: hypersensitivity to CoQ10 or constituents. Caution in diabetes due to its potential lowering of fasting blood glucose. Caution, avoidance in biliary obstruction and renal impairment. It's not advised during pregnancy or breastfeeding. Interprofessional collaboration is essential for identifying at-risk patients, implementing screening, selecting appropriate formulations and dosages, and integrating CoQ10 into comprehensive care plans to enhance outcomes and minimize adverse events. Well, thank you for listening to this talk. Please consider buying my new book, 100 Pathways to Longevity, and subscribing to this channel. Thank you very much.